Hi, Ms. Holt. As you know, you've been previously diagnosed with type 1 bipolar disorder. So, what this means is that you've had at least one manic episode in the past. A manic episode is at least 7 days exhibiting certain symptoms. These include an expansive or irritated or energetic mood, increased energy, and then also showing insomnia, flight of ideas, being hyperverbal, the kind of feeling of grandiose, and sometimes even delusions. So, from what your husband has explained to us when he brought you into the hospital, and then from our first encounter, we have verified that you are experiencing an acute manic episode. You had some flight of ideas and were hyperverbal when we first met, and you did verify that you were sleeping less, and you were telling us about how you'd recently bought a home because of the funds that you were being given for these businesses that you were trying to start up. And then after talking to your husband, we found that that wasn't necessarily true. So what we want to do is treat that mania so that we can get you home. So what we're going to do is we're going to start you on a mood stabilizer and an antipsychotic, which is first line for this acute mania that you're experiencing. So we're going to start you on what's called Depakote, that's the mood stabilizer, and risperidone, which is the antipsychotic. We're also going to stop the Lexapro that your new therapist started you on. Lexapro is an SSRI, so it can be used to treat the depressive side of bipolar disorder, but it can also cause these manic episodes. So we think that when she prescribed this to you and you started it about a month ago, you started experiencing some of these symptoms that your husband told us about. So we're going to stop that, and we're going to start these two new medications. They will take a little while to start to show an effect. So we're going to keep you here in the behavioral health unit for 1 week. So each day we're going to talk to you and assess your mood and see if you have been stabilized. Once you've been stabilized, we are going to allow your husband to come get you. So you'll be discharged. You'll go home. We do want you to have somebody around at all times, and just have your husband or your neighbor, who I know helps out, come over and just make sure that you're taking those medications. We're going to continue the mood stabilizer and the antipsychotic once you've been discharged, so that you are less likely to have another one of these episodes. It's also recommended that you continue to get some sort of psychotherapy, and first line treatment for bipolar 1 disorder is something called group psychoeducation. So in a group, you'll meet with a psychologist, and then they'll go over with you and your husband and talk to you a little bit more about bipolar disorder and how you can address and you can tell when you're having some of these similar symptoms in the future. If that isn't working out for you, we can also kind of go back and do the cognitive behavioral therapy that you were getting before, but with just a different therapist than you were seeing before. We're afraid that she wasn't managing the bipolar disorder and your symptoms as well as she could have been, so we're going to recommend a different therapist for you. Do you have any questions for me?